Hello everyone, welcome back to another session with Educatus. We have completed the first section of class 12 that is related to the digestion and absorption of different nutrients, and today we'll be entering the second section and discussion related to the second section, that is section B. It includes different chapter on the pregnancy, nursing, that is the lactating mothers, the infancy. And today we'll be talking about some topics related to pregnancy. Now, why this topic is so important? Because pregnancy and lactation are very important phases of a woman's life where there is tremendous physiological and psychological and certain other or several other changes in the body. And in this period, the demand for nutrients, the demand for proper balanced diet is of utmost importance and the demand increases. So, as a nutritional um, caregiver, a nutrition caregiver, or you can say as a nutritionist, we are there to talk about the different changes that is there during this period and why the changes is there, what is the extra requirement, because pregnancy is that anabolic phase where a baby is born with everything that a mother has, everything from the mother's body, like the nutrients, the blood, the tissues, etc. It's definitely a very complex concept where various genetic, social, economical, emotional, environmental, different factors, they are associated with the pregnancy, and all these are also related to the type of food that a person will take or the pregnant lady will be taking, which will actually affect the fetal life. So, if we talk about or if we take care about the beginning or the conception of a pregnant woman or of a woman, then we can actually talk about or we can actually take care of the lactating part and thereafter the infancy part of the child who has taken birth. So, pregnancy, lactation, infancy, they are all connected to a single string, and that string has to be properly tied. They're all connected to a single string, and that string has to be properly tied by good nutrition, by proper health care. So, welcome back to Educatus. Myself, Manjishta Chatterjee, and stay tuned with this channel because very often I can't give the videos, but now I think I will be able to give you videos very often. So let us move on to the details of today's discussion, that is the different physiological changes that takes place during pregnancy. So now let us discuss what is pregnancy. So, definition of pregnancy. We know that it is an anabolic phase. A baby is taking birth. So, how it is taking birth? The egg is fertilized by the sperm and it is implanted in the lining of the uterus. Then it develops into the embryo of the fetus. Now, each and every pregnancy is divided into 3 trimesters, as you can see in this photograph. Now, this is the first trimesters. If we divide into month, it is 0 to 3 months. If we divide it into weeks, it is 0 to 13 weeks or approximately. Second trimester, 3 to 6 months or 14 to 27 weeks. and 6 to 9 months, or 28 weeks to 42 weeks approximately. So this is the basically the trimesters, 3 trimesters. The total pregnancy is divided into 3 trimesters. The first trimester 0 to 3 months, second trimester 3 to 6 months, and third trimester 6 to 9 months. Now, what are the different bodily changes that takes place during pregnancy? There are definitely different hormonal fluctuations. Now, a woman's body is controlled by hormones. We all know that. So there are definitely hormonal fluctuations. There are changes in the taste buds. Nausea is there. There are too much of cravings and aversions. Both are there. Weight gain is there. So if a normal mother is there with a normal BMI, the weight gain is around 11 to 13 kgs. There are backaches, water retentions is there. Why these are taking place we'll be discussing, but these are the changes that can be seen in a pregnant woman or a woman who is being pregnant. And there are also enhanced sense of smell. There are also different changes in the urinary system, abdomen, gastrointestinal system, endocrine system, and all these are enlarging due to the reason of the enlarging fetus on the different organs of the body. So let us one by one discuss about the different changes, the physiological changes that occurs in our body. First, the most important is the hormonal changes that takes place. The 6 key hormones of pregnancy that you can see over here are: the first one is the HCG, or the human chorionic gonadotropin hormone, the progesterone, estrogen, prolactin, relaxin, and the oxytocin hormone. Now, they have their particular functions in our body. First is the HCG. Generally, it rises in the 5th week. You can see it can rises in the 5th week and is basically produced by the placenta. And mainly it is produced after the implantation. Definitely, it supports the function of the corpus luteum, which is the temporary structure of the ovaries, and it is very essential for the early pregnancy. And this is the hormone which is detected by the pregnancy tests. Second, this is the progesterone. Mainly, it rises, as you can see over here. It has an elevated rise in around 35 weeks. See, it is at first it is produced by the corpus luteum, but it doesn't have any rise over there. And then from the 10th week it is produced by the placenta with a rise in the 35th week. Mainly, it establishes the placenta, and all the blood vessels that supply the womb, and it inhibits the contraction of the uterus, because if we don't inhibit the contraction of the uterus, the baby won't grow. So it helps in that. It also strengthens the pelvic wall muscles for labor. So that's why, as it does that, it has a rise in the last trimesters, because that time we need to strengthen our wall muscles for the labor. Its main function is there. Next is the estrogen. Estrogen also, it has a high rise in the 35th week. It is mainly established by the corpus luteum, with a slight rise in the 5th week, around 5th week, 10th week, and high rise in the 35th week. It helps the uterus to grow, and it also maintains the lining. Along with that, it helps in the development of the fetal organs. All the other hormones which are there, it activates and regulates all those hormones. With the help of progesterone, it helps in stimulating the breast growth and also the development of the milk ducts, which is again very much essential during the late pregnancy, when the pregnancy will end and the period of lactation, that is after the child's birth, that will develop. Now coming to the prolactin hormone. Prolactin hormone, as you can see, the rise is at the 40th week. That means it will rise at the end of the pregnancy and at the starting of the lactation. It's the main hormone which is produced by the pituitary gland, and it's the main hormone which produces the breast milk. It helps in the enlargement of the mammary gland and mainly prepares them for the milk production. It also, the progesterone which is there, it also inhibits the lactation during pregnancy. So if pregnancy and lactation goes on and on, then there will be a clash. So thereby, progesterone during pregnancy inhibits the lactation, which is again stimulated by the prolactin at the end of the pregnancy. Now the relaxin. Relaxin has a rise around in between the 5th to 10th week, mainly produced by the corpus luteum, at the end produced by the placenta. It inhibits the uterus contraction, which is very, very important for to prevent the premature birth, and it also relaxes the blood vessels, which actually helps the increase in the blood flow to the placenta and the kidneys. And it also relaxes the pelvis, softens and lengthens the cervix, which is very useful for the during birth. Oxytocin, this hormone, you can see that it has a rise in around 38 weeks, steep rise with a lowering down effect at the end of the pregnancy. So it generally starts the labor. So it rises at the start of the labor, which basically starts the contractions of the uterine muscles, and it triggers the production of the prostaglandins, which increases the contraction further. And if labor is not started naturally, then we need to push it. It is mainly produced by the pituitary gland. So these 6 key hormones which are released during pregnancy, either by the placenta or by the pituitary gland, some by the corpus luteum, has different functions related to the development of the uterus for the child to grow, and also some are related during the labor, and some are related during the breast milk production, that is after the baby is delivered. So these are the hormonal changes that takes place from a normal person during a pregnancy in a normal girl. Coming next to the metabolic changes. So these are very important because I told you that's an anabolic phase. So when there is anabolic phase, the BMR will definitely increase, and the BMR increases to about 30% higher. This increment is due to the need of the growing fetus. Okay, and definitely it will be a positive nitrogen balance, that protein metabolism. So that's why during pregnancy the requirement of all nutrients, as I said, has increased, and a balanced diet has to be given to the mother, would be mother rather. In carbohydrate metabolism, the insulin secretion increased, the sensitivity of the insulin receptor reduced. Fat metabolism, 3 to 4 kg fat stored at the abdomen, breast, hips, and thighs. So these are the areas where fats are stored. HDL level is increased. LDL level is used by the placental steroid synthesis. Now this increased HDL level, they are very good for the child's development. Okay. Iron metabolism, pregnancy or any girl is maximum of the girl is in an iron deficiency state. So absorption from gut is increased, but they are lost along the roots, it is said. So what happens? Serum iron and ferritin supplementation will we have to give them. So whenever there is a pregnancy started, so IFA tablets, that is the iron and folifer tablets, has to be supplemented with along with the food that is being given. So anemia during pregnancy is a like very bad condition that has to be taken care of. Okay, and different kind of problems can take place due to anemia during pregnancy. What can happen? See, mothers can be susceptible to infection. They can be preterm labor. That means the labor can be before the term. Even the delivery can be before the term. They can be postpartum hemorrhage, mental fatigue, loss of working hours, and even death. And if it is to the child, what are the problems or the fatal causes, effects of anemia on the child, fetus? If there is a folate deficiency, especially, there can be problem related to neural tube defects, miscarriages, low birth weight babies, prematurity, anemia in infancy, and there can be IUFD. OIUGR, that means the growth will not be fulfilled. The level of growth which is expected, that is not there. It will not be completed. And IUFD, that is intrauterine fetal demise, that means the birth, there can be even death of the child. So if we can classify according to WHO what is a state of iron deficiency anemia, when the hemoglobin level is below 11 gram per dl. So that is the classification. 8 to 11 it's a mild, 5 to 8 it's a moderate, and 5 below 5 it's severe. There can be seen that 56 million women globally, they are anemic. 58% according to NFHS 3 data, they are anemic. 78% lactatic, 78 lactating, 75% pregnant, they're anemic. And anemia is the cause of 20% direct maternal death and 50% indirect maternal death. So we really need to treat anemia. So when we will be planning diets for the pregnant women, iron and folic acid and different diets related to that has to be taken care of. So when we will be doing a video on that, so we'll be focusing on this point too, right? Let us move on to the digestive changes. The digestive changes slows. Why? Because there is the um, growth of the fetus, and when the growth of the fetus is there, our prime focus is to keep the fetus well and give them extra space. So everything is in compromised situation within the body. So there is the displacement of the stomach, appendix is also displaced, there the gastric emptying, intestinal transit times, all of these are delayed due to the change in the hormonal factors. As I told you, there are different relaxin muscles and all. Relaxin hormones also, it relaxes all the muscles. The smooth muscles, they also relaxes. The intestines are also the intestines are also pushed. Okay, so all these things, there is a lot of change in the digestive system only to give space to the growing fetus, leading to different trouble like morning sickness, constipation, hemorrhoids. These are the common problems that these are the common, rather, digestive problems of a pregnant mother. So we'll be talking that in another video, like where are the problems related, the complications related to pregnancy. In the next video, we'll be talking about that. But the digestive changes are these. Now the cardiovascular changes. The size of the heart increases about 12%. The cardiac capacity increases by 70 to 80 ml. The cardiac output increases. The blood volume increases. It has to increase the blood volume. The beat also, the rhythm also increases about 10 to 15 beats per minute. Why? Because the cardiovascular system is also readjusted. The blood volume is increasing greatly. The blood vessels are growing. The pressures, because of the pressure that is created by the expanding uterus on the large veins, it causes the blood to slow in its return to the heart. That is why the blood pressure increases, the blood volume increases, resting heart rate increases, but the resistance decreases, and around second trimester, not the first trimester, because in that time the changes are not that much, there is a decreased blood pressure. Okay. Next is the respiratory changes that takes place. See, this is the condition of a pregnant woman's. How compromised the diaphragm is. Just see. This is the non-pregnant condition and this is a pregnant condition. So the muscle soreness increases, the pulmonary reserve decreases, there is shortness of breath. So respiratory rate increased, tidal volume increased, and always the functional capacity, it is decreased, because the oxygen, the maternal oxygen consumption, which is actually the demand for the uterus, the placenta and the fetus, it is always high, and the oxygen capacity, which is the oxygen that the mother is getting, is low. So the functional capacity will definitely be decreased, and the pregnant women will always feel out of breath. When we are, suppose we are moving or we are climbing up the hill, so we feel breathlessness, right? And suppose we are climbing up the hill with the load, so we'll feel double breathlessness. So our functional capacity decreases, the rate of respiration, that is the respiratory rate, it increases, and the tidal volume increases, and the pregnant woman feel out of breath. Now, what are the kind of kidney problems that takes place? The GFR rate, the glomerular filtration rate increased, the intraglomerular pressure increased, hyponatremia and hypokalemia, that is lowering of sodium potassium level is seen. There is intravascular volume increases and the plasma volume is also increases. Other than that, uh, kidney stones are very common during pregnancy because there are high urine pH. The pH of the urine is very high. Along with that, there are more calcium oxalate uric acid, that is the stone forming material, promoting material are there in the urine, and the urine doesn't flow properly out of the body in a proper manner. Okay, so related to that, there are certain signs and symptoms that can be seen, or in which we can find or diagnose the problem of a person related to kidney. That is, there can be pain during urination, blood in the urine, there can be swelling, and also dry itchy skin, kidney stones. Proteinuria, swelling in the face, hands, feet, blurring of vision. Why, that we'll be talking about in the complications of pregnancy in another video. So these are the common symptoms that can be um seen during pregnancy. This can be caused by the UTI, that is the urinary tract infections, can be caused by stress and fever, and due to dehydration and high blood pressure. So we have to take care of these, and we have to hydrate the pregnant women with not only water but also fluid. Now, what is the difference between water and fluid? It is very important to know. So we have to keep hydrating the pregnant woman with water and fluid. So, in a nutshell, if we just want to conclude, in blood, the changes includes there are increased number of blood cells, all due to the always keep in mind the changes that occurs in pregnancy is due to the if it is the effect of the growing fetus. So the increased number of blood cells, there are clotting factor increases, the fibrinolytic effect or activity increases, and there is iron deficiency anemia, which is very common in each girl, and during the reproductive age it is very very common. So we have to take care of the mother and the offspring as well. Cardiovascular system, there is tachycardia, increased cardiac output and heart rate, and stroke volume. Respiratory, the diaphragm is displaced superiorly as I've shown you in the picture. There is functional reverse capacity, it is decreased, and there is increased risk of apnea and dyspnea, and hyperventilation is also there. Why the breathlessness is there, I've told you. Gastrointestinal system, there is nausea and vomiting. Heartburn and acidity are very common during pregnancy. Other than that, there are modes and behavioral changes, and also there are increased nutritional demands, which we'll be definitely talking about because that's the most important part of the pregnant and the lactating mother, because we really need to treat them with the help of the diet. So I hope you liked the video. Stay tuned with Educators. Thank you. Don't forget to like, share, and subscribe the channel, and put the bell icon for more notifications.